The City Speaks. We brought you one episode about things about COVID-19 when we first went down on shutdown. We just thought that there was a need right now to come back again and refocus the community on what's about to happen. So we've been shut down, locked in, social distancing now for a little over a month. And the mayor, the governor has extended it now until May the 8th, which is one more week. COVID-19 has changed our lives as we know it. And even though the restrictions on our behaviors is about to change, it doesn't mean that we need to change our practices. Because even though they say it's okay to be out and about in the community, it does not mean that this virus is going away. The infection rate will continue. People are still going to get sick. Your ability to protect yourselves, your families, and those you love is going to be essential as they ease the restrictions on the practices that we make as far as our social encounters or our social travelings or the means in which we deal with the people in our surroundings. This is a lot. It's almost heartbreaking. I know many people have lost loved ones. I guess I'm blessed. I've had no one in my immediate family that I've lost. But there are members of my family who have lost close loved ones. My father lost his best friend, lifelong friend. I have one social acquaintance who's lost his father. I have a classmate who's fighting for his life as I speak right now. For all those families who have been personally affected by COVID-19, my heart goes out to you. But even though we grieve those that we've lost, it's time to take action for those of us who are still here, who still have to live and still have to maintain our lives, our families, and our jobs. If you have been watching the news, you hear of the deaths. I don't know if all broadcastings across the country are putting out things in relations to race, but today I am going to address the racial disparities for COVID-19 in the United States. So the National Center for Health Statistics is beginning to post out some of the data for those states who are reporting racial disparities. Not all states affected by COVID-19 report whether or not the person having the coronavirus or dying from the coronavirus is black or white. But for those states that do report, the disparity is exponentially affecting the black community. In our District of Columbia, our nation's headquarters, African Americans compose of 46% of the population there. Yet and still, 81% are affected by the COVID virus. In Mississippi, we compose of 37% of the population, but 63% have been affected by COVID. In the state of Georgia, 32% by population, 55% by infection and mobility. In the state of North Carolina, my home state now, 22% of the population is an African American, but yet instead, 37% are affected by this virus. The numbers go on and on, and on and on, and on and on. I could tell you every state that is reporting where we are a minority as far as the population, but we are a vast majority for those affected and dying from this virus. And I guess we all sit back and we wonder why. As a health provider, let me tell you why. As a culture, it is not an average for the African American culture to take very good health care seriously. Our culture is affected by a couple of things which are greatly affecting our infection rate and our morbidity rate with this COVID-19. And it's a part of our lifestyle. It's the way we eat, the way we live, the way we socialize. Obesity is one of the biggest problems in the Black community. Diabetes, hypertension, asthma. And it is not that it's because of just these disorders, but the lack of our culture to obtain proper medical care, to care for our disorders, to be willing to change our lifestyles, to live healthier. These are the things that make it harder hit for our community. And maybe we're not willing to acknowledge these things, or, it's just been a lifestyle for so long it just doesn't matter anymore. But COVID-19 is real. It's no respecter of person, culture, lifestyle, our traditions, or anything that we know. So, now it's time to take action. So, we're about to open up the country again. What does this mean? Just because they're opening up a country, just because they're opening up your state, it doesn't mean that your practices need to change. Understand me, COVID-19 is not going away. If you look at China and the things that happen in China, it's back again. And it's more fierce. It's seriously more fierce on the second wave than it was on the first wave. And even though we're getting ready to open up, it seems as though right here in the United States, there's a second wave going on right now. There are people who have already been affected and now are reporting that they're again positive after being quarantined for 14 days and all. You have to take this thing seriously. As a people, as a county, as a state, as a nation, lifestyle changes are needed. And they're needed yesterday. And I know even in the African culture, it is our diet, it is our traditions that make us have so many comorbidities. But if you have a loved one that you're concerned about, that you really, really love, you need to find them a primary care provider. We need to make lifestyle changes. We need to change the way we eat, the things that we consume. We need to build our immune systems so that we have a defense mechanism against this next wave that's coming. Because rest assured, it is coming. If you listen to the news, it is coming. And whether or not you're prepared, your loved ones are prepared, your family is prepared, your neighbor is prepared, we have to get ready. And now is the time to start. Not in the fall when they say it's coming back when it gets cooler. Because they say we're going to have a relaxed summer. Now is the time to prepare. Changing the way that we eat. Changing the way that we think. Changing the way that we live. Now is the time. Okay? Listen. Now is the time. We need to watch the news. Or, have you noticed? The farmers are having a hard time. They're plowing under the crops. The dairy industry is dumping thousands and thousands of gallons of milk each day because there's no market. Our president has closed down the country. We can't get any migrant workers in for the farms. The farmers are plowing under their crops because it's better for them to take a loss than to sell it at a market and not make a profit. Are you ready? Is your family ready? How many of you have went to the stores? There's nothing to eat. There's no chicken. There's no hamburgers. It's hard to find food in the stores unless you're there time the truck hits. How many of you have started to prepare to provide for yourselves? Now, I know maybe this is a little bit old school for any of you, or for most of you rather. But when I was growing up, my family had a garden. We raised our own vegetables, and they were fresh. And it's time now for you to think of doing the same thing for your family. Planting tomato plants, onion plants. It doesn't take a lot of space. If you've got a flower bed, you can plant a garden in a flower bed. You got a 5-gallon bucket, you can grow tomatoes. There are so many things that you can do to begin to prepare your family for this next wave. It is going to come. If you look at the past endemics, when we had the Spanish flu and everything, once the pandemic leaves, then the food crisis comes. Are you ready for the food crisis? It's time now, instead of us being reactive to everything that goes on after the fact, it's time for us to take a proactive approach to preparing for our needs, our feeding, and everything that's going to happen or that's going to be affected by this pandemic. The supply chain is going to be affected. You might not see it today, but just wait. It's coming. I told you. So let me give you some more statistics. So from an article that was sent out in the New York Times on April the 11th, in Idaho, the farmers who raise our onions plowed under 1 million pounds of onions. 1 million pounds. Because it was cheaper for him to bury the onions and to replenish his ground than to sell it in the market and make a loss, because he was going to get no profit. In Wisconsin and Ohio, the dairy farmers each day dump 3.7 million gallons of milk. 3.7 million gallons of milk a day wasted because of this pandemic. Sanderson Farms reported that they kill or smash 750,000 eggs a week. These are chickens that would go to market for us to buy. 750,000. If you can't see the writing on the wall and what we need to do for ourselves, I feel for you. The time to prepare is now. Plant a garden. Raise some vegetables. It's time to start investigating alternative lifestyles for obtaining the proteins for your family. Different dieting spectrums. It's time to get healthy. It's time to make a difference in your life. The choice is up to you. I can only provide you the information. I am a medical professional. The choice is up to you. But we're here to guide you, to assist you. If you should have questions, feel free. Call us, text us, use the contact information provided. We'll help you along the way. But the choice is up to you. The responsibility is up to you. But now is the time to act. Don't wait until it's too late. Because once it all falls down, it's too late. We need to take a proactive approach to our health care, to providing for ourselves, and to be ready for when this pandemic hits again. I thank you for your time today. See you next time. This is The City Speaks.